And welcome to December. It's a beautiful month because of Christmas, and it's also my birth month. 20th December is my birthday. And I love this month because it actually gives us an opportunity to reflect on our lives from January to December. How has your life been? Are you able to go back and feel that you've achieved all that you wanted to achieve? While thinking about that, today on the Reflection Show, we'll be looking at how we can take care of our teeth. It's the Christmas season and we'll be eating a lot of meat, food, drinks, etc. How do we still maintain a healthy teeth to make sure that when we cross over to the next year, we are strong and healthy for our families? Today, I'll be speaking with Dr. Cephas Ayogani. He's a dentist here in Tamale and also in charge of the Cornerstone Health Practice or the Cornerstone Dental Practice here in Tamale opposite Garaba Lodge. They'll be running some promotions to help you and your family to go and get your teeth checked. So later in the show, he'll be giving us all the details, and of course it's very, very, very affordable. My hair and makeup is by In-Depth Beauty Salon here in Tamale. My name is Martha, and let's go for a break. When we are back, we delve into the discussion. Merry Christmas. Hello and welcome from the break. Today we want to look at dental care, how we can take care of our teeth and how we can stay healthy. I'm here with Dr. Cephas of Cornerstone Dental Clinic here in Tamale. Thank you very much for joining me on the show, Doctor.
Thank you for having me.
So straight to the point, dental care, what is it all about?
Right, so the mouth is the gateway to the body. So structures of the mouth are supposed to be healthy so that that gateway can be healthy. So all the structures in the mouth, starting from the teeth, the tongue, the soft tissues, that is what encompasses the oral environment.
Okay.
So how to keep them clean, how to keep them healthy so that the whole body can be healthy is what we talk about as dental care.
Okay, so moving straight, the teeth is like that's actually what most times we actually concentrate on. People having white teeth, yellow teeth, other kinds of teeth. Is it true that having a pure white teeth means that you have a very healthy teeth?
The color of everybody's teeth is white, but the white has different shades of white, just like our skin color.
Yeah.
We are all termed as black people, but we have different shades of the black. So in the same vein, the teeth are white, but they have different shades of the white. So the color of my teeth will not necessarily be the same as yours. So whiteness is in grades, and it depends on the level it is. But it goes beyond just white. The health of the teeth is not measured by the whiteness, because you can have deposits of plaque between the teeth and the gum, and that is not visible to somebody when probably you just have a small smile. You might smile and they will see that your teeth are white, but beneath that, or the inner part of it, there might be some deposits that is giving you health problems. You could be bleeding when you are brushing. That could be a health problem.
Before we get into brushing, how do I know that maybe are there some symptoms that I'll know that my gums or my teeth is becoming bad?
The first sign is bleeding when you are brushing. Under normal circumstance, you should not bleed when you brush. If you bleed, if you see traces of blood in your toothpaste when you are brushing, there are two things. Either your gum is diseased, or the brush you are using is so hard, you are traumatizing the gum to bleed.
No matter how small the blood is,
yes,
it's a sign.
Yeah, it's a sign.
Wow.
So once you are bleeding, it means that there's a problem. Number two is a sensitivity to cold or hot. God made the teeth such that they are covered by an insulator. What you see as a white part of the tooth is actually an insulator. Beneath that is the part that has nerve endings, so it can respond. So it's like an live electric wire with a rubber covering. When the rubber covering is there, you can hold it without being shocked by the light. But once it's exposed, then you can have shocks when you hold the bare wire. So the same way, when you begin to have sensitivity, then it means that there's a breach between that covering, that insulator, and then the inner part. So sensitivity is one sign. The next thing is pain, of course, the almighty pain. If you begin to have pain, then there's a problem. The other one is swelling. Everybody should know the normal gum feelings. Your tongue should be able to tell whether there's a swelling, whether there's a growth. So if you begin to see that there's a growth or there's a swelling, whether it's painful or not painful, there is an abnormality.
Let's move a bit to children.
Right.
Parents that might be watching, we know that the normal thing is, I think by age 5, 6, 7, the tooth begins to go out for new ones to come. How is that process kind of, can an adult just have the tooth go off? And so, like, concentrating on children, how is that, and what should parents note?
So, tooth development actually starts in utero. In utero is when the baby is still in the womb. So your tooth development starts there. But they don't begin to erupt until the child is born.
It's born, okay.
But there are always exceptions. Somebody can be born, a newborn can have a tooth in the mouth. Some people associate it with a lot of myths.
Yeah, spiritual stuff.
Yes, but it's normal. You can have a baby born with a tooth already in the mouth. But the ideal thing is they start to erupt around age 6 months. So the first 2 teeth that come from the lower jaw are usually 2, and they come around the age of 6. So what parents should know is when the child is born, they don't have teeth. They suck first 6 months, they are doing exclusive breastfeeding, so they are on milk. The moment the teeth begin to come, you should start developing the habit of cleaning. Just with maybe a piece of gauze and warm water to clean the teeth.
Okay.
When they are also coming, because they have to push through the gum usually gets inflamed around that time. So we have what we call teething, giving rise to pain, children crying around that time. So again, if you have a warm water with salt and then you clean, it soothes the area. It relieves the pain because the inflammation that comes as a result of the teeth trying to push out, it will relieve the pain. Sometimes when it's too severe, you might have to give a painkiller. So those are the things you need to observe. So the teeth start coming, and then by age 6 years, the lower ones that came first would begin to fall off for the adult ones to come.
Okay.
So 6 years, the first adult teeth at the down would also come.
Okay.
So the ideal thing is that when they are coming, they will come directly under the baby ones. And then they will cause the roots of the baby ones to resolve, and then they will push out, the baby ones fall off, and then they will take over. But in some few instances, you might have them coming in front or behind. In that case, the baby ones will still be retained. So when that happens, you see parents becoming anxious. Oh, my child has double teeth. There are some growing here, there are some growing there. So usually we advise that bring them, we have a look at the child. If there's a need, if we see that the baby teeth are going to stay there longer, they won't come out anytime soon, then we'll take them out, because 2 things they do. They cause crowding, food packing, and then cleaning difficulties. And of course, children in school, their colleagues might laugh at them. You have so many teeth in your mouth, are you a vampire? Those kind of things. So basically, we advise parents to come with the children when they have those problems.
There are times that we see that people's tooth, there's some kind of, I don't want to use the word decay, but it gets very bad in color.
Yes, so color changes can be as a result of things that we eat staining the teeth. If you take palm oil, for instance, you have palm oil stains on your teeth. If you smoke, you have nicotine stains on your teeth. If you take coffee, you have coffee stains. So kola nuts, you have stains. So that's number one. You can have stains on the teeth. We naturally also develop what we call plaque. Plaque is this soft substance that will remain on your teeth after eating.
Okay.
So the plaque can also discolor the teeth. In addition, the plaque can get calcified and become hard, and then we get what we call calculus.
Okay.
Some of the pictures that we have will be showing them.
Okay.
So the calculus can also change the color of the teeth. So basically, those are the things that changes the color. But I have to also mention that there are people who, depending on where they were born, they could take in some water that has a lot of fluoride. The fluoride that is in the water, usually too much of it, I must say, would deposit on the teeth and then on your bones. But because bones are usually not visible, you will not see discoloration of bones.
Okay.
But that discoloration will come on the teeth, and it usually affects all the teeth. So if you are aware of some areas in the Upper East, for instance, Bongo area, you can see there's too much water, fluoride in their underground drinking water. So a lot of them have that problem. So fluorosis is one way that teeth can be discolored. The next one is some medications that are taken by the mother when they are pregnant or during pregnancy, or by the child when they were developing. One of them is tetracycline.
Okay.
So tetracycline can also give rise to staining of the teeth.
Okay.
So basically, those are the things that can discolor teeth.
In adults, you've mentioned all of these things. Are there other medical conditions like cancers that can distort someone's teeth?
Obviously, yes. Cancer can happen anywhere in the body. So you can have oral cancers as well.
And that one, dentists can't help it because it's a cancer.
The dentist is the first point where the cancer can be actually localized. If a cancer starts in the mouth, you are not likely to get diagnosed by your general physician, because the first point of call will be your dentist.
Yeah.
So it is a dentist, or what we call a maxillofacial surgeon, who is actually specialized in other part of dentistry, who will identify it. If it has to be treated by surgery, then it is the same maxillofacial surgeon who has to
would identify that.
do that. And then, of course, cancer treatments, we have basically three. It can be surgery, it can be radiation, it can be chemotherapy. So if it is surgery, then the maxillofacial surgeon does it. Then the oncologist will then take over and do what we call the chemotherapy. The radiologist would go in for the radiotherapy. So cancer is actually a multidisciplinary thing. No one doctor treats it. But you can have cancer from other parts of the body that will spread probably to the mouth. So in that case, it is a source
that will be treated.
But whatever it is, a dentist during routine examinations can pick up some groove. If you have a groove in the mouth, and that's why earlier on I said that if you have a swelling or a groove in the mouth, even when it is not painful, you need to be alert. Then visit the dentist. Once we see it, we examine it, then there might be the need to even take a biopsy for examination, and then an identification can be made as to whether the groove is a cancer or it's just a normal groove.
I want us to look at some of the images that if you can get the images projected on the screen. Yes, so just take us through this and the other images.
So I picked this image for one thing. If you look at that image, there are percentages to what you see. What people notice first when they meet someone. The first thing they notice is not your eyes, it is not your smell, it is not your clothes, it's your smile. 47% of what people would perceive you to be is your smile. So when they meet you and you don't smile, then they already have an informed impression about who you are. Right. So this is just to show you how important a good smile is. You can only smile when you have good teeth. If you don't have good teeth, definitely you
always want to close your mouth. Yeah,
so that's the essence of that picture. Right. We can go. Now, oral hygiene.
Viewer discretion is advised.
This is actually somebody's teeth. The top ones, you can see the cavities in them. The down ones are after the cavities were worked on and sealed. So the top 3, you see the cavities. The down, the person saw a dentist and the treatment was done. So it is possible to work on these ones. You don't wait until pain starts.
Okay.
At this stage, the far left one, if the person had waited a little longer, that tooth could have been destroyed. And the only option would have been to take it out. Or to do a procedure called root canal treatment.
Okay.
Right.
Wow. And people actually wait. Okay, so if you can go back so the doctor can take that one. Yes, so something like this.
All right. So something like this, you can see, we're talking about the coloration. So the top one, you can see the deposits, plaque and calculus deposits. The gum is reddish, so the gum is inflamed. So after treatment, the deposits have been removed. So the down picture is the same person, but you can see the difference now.
Yeah.
The same way, the top one, you can see the deposits. That's the inner part of the lower teeth.
Yeah.
Then after the deposits were removed, you see the lower picture. You can see the difference.
So this is like a cause of not brushing, or can that also be a cause?
Exactly, not brushing well and then not visiting your dentist regularly. Yes. So we'll be talking about probably halitosis, and some of these are some of the things that will give rise to bad breath, bad odor, usually.
So let's just delve into that, bad breath and bad odor. Apart from, let's say, once a while, maybe you've eaten something, you didn't brush in the evening, or maybe some actually take a lot of garlic that you've not brushed, but people actually have bad breath continuously. What causes that? So
what we term as bad breath is when it is persistent.
Okay.
You have persistent malodor in the mouth. So if you take garlic and then you have the garlic smell, it's because of the garlic. When the garlic goes, it goes. So somebody who has a garlic smell because he eats garlic will not be termed to have bad breath. But persistent bad breath is what we concern ourselves with. Now, there are 3 types basically. So we have what we call the genuine one, the genuine bad breath or halitosis. Then we have the pseudo-halitosis and the halitophobia. So the genuine one is where the halitosis or the bad breath is actually there, and there's a cause to it. So that genuine one, we can have what we call the physiologic breath, and then the other one that could be caused by problems in the mouth or problems outside the mouth.
Okay.
So the physiologic one is everybody gets that in the morning. You wake up, you have what we call the morning breath. So if you sleep and wake up, everybody will have some amount of bad breath, especially if you didn't brush the previous night before
Most
sleeping.
Ghanaians don't like brushing in the night.
Yes. So if you wake up, for instance, that breath is called a morning breath or a physiologic breath. After you clean your teeth, that goes. Or even if you don't clean your teeth and you eat, you drink water, you're talking, then after some time it goes. But the one that has a cause in the mouth, like the pictures we were showing, you have deposits, you have cavities, your gum is inflamed, infections in the mouth, that would give rise to persistent odor.
Okay.
You brush, when you finish brushing, you can use minty toothpaste. The moment you finish brushing, it's back to square one. Because what is causing it continues to be present in your mouth. If that is not taken care of, it doesn't matter what you do. It's like wearing a dirty dress and spraying yourself with perfume. The perfume goes, the smell will still be there because the shirt you are wearing is dirty. So until you clean the shirt, the perfume is useless. So it's the same way if you are using mouthwash or whatever for that kind of bad breath. It will still be around. Then of course we have other parts of the mouth or the jaws, like the throat, the respiratory canal, the gastrointestinal, that is the food pipe and the windpipe. Then the sinuses, the upper jaw has some holes in it that we call sinuses. So those sinuses can also get infected and give rise to bad odor. But the main one is actually what happens in the mouth. Over 90% of the causes of bad breath is usually within the mouth.
Okay.
But other extra oral can be from the sinus, the windpipe, the food pipe, and then other distant organs like kidney, liver, very small percentage. Yes.
Now let's look at brushing. I wanted to add something.
Yeah, I just wanted to touch on the pseudo one. The pseudo
Okay.
one is pseudo halitosis. There are some people who don't actually have halitosis or bad breath, but they have that perception that they have it. So they begin to react to what people do.
Okay.
So they are in public, and then somebody is talking. People have bad manners. So in public, you are talking, and then you put your hand around your nose. Then they perceive that it is because of them. They have bad breath, that's why. But you examine them, you don't see anything. The people who are close to them don't feel anything. So those people, you will usually need some counseling. Then there are some who even have an exaggerated fear, the phobia ones. So that one becomes more of a psychological thing. So they sometimes might even need psychological counseling to get them out of it. So those are the other two extremes of halitosis.
Okay, brushing. I think that is one of the things we know on how to keep your mouth clean and keep your mouth safe. But before we get into that, maybe get your brushes, stay tuned, and see how you can keep your mouth clean better and brighter. Let's go for a break. We'll be right back. Welcome back from the break. It's still the Reflection Show with me here, Martha and Abila. We are trying to help all of us understand that keeping our mouth clean is good for you and I. It's good for everyone, and especially for parents. It helps your children to learn very good habits. A lot of us are not so used to brushing our teeth in the evening. I think that it's something, I think even the last time you were on the show, you said that even the brushing in the evening is more important than brushing in the morning. Right. Now let's go straight into that, brushing or cleaning the teeth.
Okay, so I've come with my mini model.
If we can get it zoomed to the teeth.
And then I have my brush. So first of all, I would want to talk about the brush.
Okay.
The type of brush for adults. There are a lot of brushes in the market. We don't advertise for any particular company, but what we recommend for adults is a brush with medium bristles. The bristles are the ones I'm touching.
Okay.
So medium bristles is what we advise. Don't use hard brush. Don't use one with hard bristles. There's even another one called smokers. I don't know why they do it, but it's in the market. That's for market.
But there's everything in the market, just for the business.
Yes. So avoid those ones. Go for the medium bristles. For children, we advise that they use a soft bristles brush. Your brush, you shouldn't use it more than 3 months.
Wow.
So if you are using it, and it's not even up to 3 months, and
it feels weak.
It feels weak. It begins to flay, then you should change it. Sometimes, depending on the brush you buy, the bristles might not be that strong. So you might even use it for 2 months, and then it begins to. So that one has to be changed. So every 3 months you change your brush.
Or less if possible.
Or less if possible. Right. So the brushing that I advise that each of us do is to open the mouth.
Okay.
Take the upper jaw separate from the lower jaw so that you can have time. So you start from the gum to the teeth. At an angle of about 45 degrees, you would brush down from the gum.
Not like this, rather.
No.
Like this.
Yes. The reason why we are against this way is when you are doing that, essentially what you are doing is the brush gets constant touch with the gum. And the brush can wear the gum and cause it to recede, move away from the tooth. So when that happens, then the brush would get in touch with that part of the tooth that the gum covers. And that part of the tooth that the gum covers doesn't have the insulator that I was talking about.
Okay.
So it begins to wear it, and then it gets to a point you begin to have sensitivity. So you go that way, gently. The essence of brushing is to remove food particles and then soft plaque and not the hard ones. So going hard doesn't help. Just do it gently and slowly. Then you go in, do that slowly and gently. Then you brush the chewing surface.
Okay.
Brush the chewing surface. When you are done,
You come
come down. So the down one would be gum to tooth, so that one will go upwards. Like that. Then you go inside, brush inside, brush inside. Then you brush the chewing surface, brush the chewing surface. Then you brush the dorsum or the top of your tongue.
Okay.
All that should take you about 3 minutes
To brush your
to
teeth.
brush your teeth. Don't go shim, then.
And the tongue, how about clean? Someone would want to clean the
The
tongue.
tongue is very important because the tongue has a large surface area. When you eat, the fine particles will remain on the tongue. One of the causes of bad odor actually comes from the tongue because of its large surface area. And that is why we encourage that when you brush, it should be the last time, you take your time and brush your tongue very well as well.
Okay.
When it becomes, there are some people who have a lot of coating on the tongue. So when it gets to that level, we advise that you use a tongue scraper.
Okay.
That can be used to clean the tongue. But your normal brush should be able to
clean the tongue
your,
as
your
well.
tongue if you don't have any problems. So basically, that is how we brush. Let me just mention that for children, when they start growing, when the teeth start coming, as I said earlier, the advice is start with gauze with water, warm water to clean. When all the teeth begin to come, or when you have 4, 5, 6 teeth, you begin to introduce the toothpaste. But you know, children will swallow.
Yeah.
So what we advise is that go for a toothpaste that has no fluoride, ideally, so that even when they swallow, it doesn't affect them. The fluoride, if you remember, I told you too much of the fluoride will cause fluorosis. Though what we have in the toothpaste is just minimal for the strength of your teeth. The teeth also need fluoride to strengthen them. So we need fluoridated toothpaste for brushing. But for children, because of the fact that they will swallow, we advise that when they still at that age where you cannot give them commands to obey, use a toothpaste that has very low fluoride or no fluoride.
Okay.
Then it gets to the point where they can begin to appreciate your commands. Then you can use a children's toothpaste, which has a recommended amount of fluoride. Again, we advise that when you start, you brush for them. When you finish brushing, you can give them the toothbrush to also do it. So they start learning that way slowly, slowly. By the time they are 7 years, 8 years, 9 years, then they begin to start brushing themselves.
Okay.
You can brush, give them to brush, put the paste there, they'll brush. So by the time they are 9, they can brush themselves. So usually that's how you do it slowly and build up.
You've mentioned how we can be able to notice that our gums or our teeth is not well, but are there any special symptoms in children?
The same way, so you look at the color of the gum. If it becomes reddish, then there's a problem. Bleeding, there's a problem. Swelling, there's a problem. And of course, the teeth, you also have to observe the teeth, whether there are cavities. If you notice any cavity, then you don't have to wait till pain starts. Usually when the cavity starts, it's still at the insulator part, so you don't feel pain. But you don't have to wait until pain starts. You report to your dentist, the cavity is dealt with, sealed, and then the problem ceases.
Okay, so now, do we have hard teeth and soft teeth? Do we have those things? And
Not necessarily hard teeth and soft teeth, but the tooth is the hardest substance in the body, harder than even the bones. The
really?
reason why it is hard is because the enamel, the outer part, is highly mineralized.
Okay.
So during development, if the mother, if the mother lacks some of those ingredients or mineral salts that would help mineralize the tooth, then it becomes hypomineralized or
Okay.
undermineralized. So when it is undermineralized, it's just like a molding block with inadequate cement. If you take that block and drop, it will break
That's
into
all.
pieces. So the same way, if you don't have enough mineral content in it, then it becomes brittle. So it breaks easily.
Okay.
So it won't be termed as soft, but it's brittle.
Okay.
So it can easily break. So you see them, those people come with teeth that will break. They will tell you, oh, my teeth have been getting shorter and shorter because the mineral content of the enamel is not adequate, so it is breaking. Yeah, so basically that is that. Once it's well mineralized, then you don't have a problem.
Okay. Just landing on that point, I see that you have some things on the teeth. We see people having things on their teeth. What is it called?
So this is braces brackets.
Okay.
So braces are usually done to correct the alignment of teeth.
Okay.
So you can have children or even adults whose teeth are not well aligned. So we use this to realign the teeth and get them perfectly arranged.
How long does it take to get it aligned? I see people
Usually-
wearing it for a very long time.
Usually a minimum of 1 year, depending on the complexity. There are some who even wear it for 2 years, 2.5 years, depending on how complex it
Yeah.
is. So it varies, but a minimum of 2 years for the simple arrangements would be okay.
Okay. People also come to remove their tooth and put in shiny tooth.
They actually don't remove and put shiny ones. What they
Okay.
do, especially those who go to Mecca, what they do is a foil that they put on the existing tooth. So they just put it there. You go to Mecca and then probably you want to show that you have been to Mecca. You get that and then you put it. They usually say it's gold, but it's actually not gold. It's just a foil.
Yeah,
that
just
looks-
it's
yeah,
just that color that is
color,
attached
yes,
to it.
yes. But you can do a gold tooth if you want. So we take a measurement and then we mold the gold tooth and then fit it there. But if you have a tooth that is lost, a tooth is removed, it can be replaced. And the replacements are, we have different types. You can do what we call a removable replacement, where we do it, you can remove it yourself and fix it back. Then we have a fixed replacement. Fixed replacement could be what we call a bridge, so the adjacent teeth would be used to support it, or what we call an implant. So we put something,
Artificial.
artificial into the bone, and then we'll now put the tooth on that.
Okay.
So missing teeth or lost teeth can be replaced.
Okay.
Again, teeth that have gone through a lot of damage. Let's say there was a big hole there, and the hole has eaten maybe more than half of the tooth away. After treating it, you will not have enough tooth substance there again. So we can do what we call a crown to fit it there. Then it's molded back to look exactly like it was. So that can also be done.
Is it healthy?
Very healthy.
Okay,
You
doesn't
know,
come with any
no.
complications.
If you don't have teeth, you are actually not healthy. Because it means that you cannot chew well. You cannot. Digestion starts in the mouth, and if you don't chew, the food cannot start digesting in the mouth. So when you have missing teeth, we advise that replace them. If you have broken down teeth,
So it's replaced with the artificial teeth.
yes.
Is it as healthy as the natural teeth?
Nothing artificial can be as good as your natural.
Okay.
But in terms of health, it is, because it has no effect on your body. It has no effect on your anything in your mouth. The only thing is that just like we advise that every 6 months, even the healthy person should have a dental checkup. Somebody who also has artificial teeth will still also need
We'll have to get that checked.
dental checkups done.
Okay. Now, we see that sometimes when we eat, we see that some of the meat get into our teeth. Is it a normal thing? Is it a proper way of removing them? Or you can just, sometimes we just look for a broom and just break it and remove it. Or there are proper or nice ones we can use to remove them.
That is what I brought this one to. So this is what we call floss. The teeth are actually not joined together.
Okay.
They are standing close. They can get contact. Some people's teeth don't even get contact. They don't touch each other, but mostly teeth are, all of them get contact. So the one is in contact with the next and so on. So when you eat, it's possible that food can go in between the teeth.
Okay.
So when food goes in between the teeth, we advise that they are removed. But we don't advise that you use toothpick or broomstick. You use what we call a floss.
Okay.
So the floss goes in between the teeth.
Okay.
You push it down and then you remove whatever is there. So this is one type of floss. There is another one that is thread. So you pick it, then you cut it like that.
Oh.
That one you have to roll it on your fingers.
Okay. That's the floss.
Yes, floss. So you roll it like that, and then you open your mouth, and you go in between, and then you clean. So we
Is it done for children or adults?
Adults, everybody. So we don't advise the use of toothpicks and broomsticks. This is what you are supposed to use, floss.
Hey, we've been doing it the wrong way all this while.
The type of floss, you have the thread one, and they are both thread, but this one has a handle, so it's easier to hold it and put between the teeth to clean. So
then it looks like one should probably usually have this type in their bags wherever they go.
Yes,
because
so
if they
for
eat,
you see, this is one that has 25 pieces. So when you use one, you throw it away. So you can have it in your bag.
I remember that joke of a house help who was like, the mother was asking them about the toothpick getting missing in the house, and she was like, "But I'm not the one. It's your daughter. Me, when I use it, I put it back." So when you use your toothpick, you're not supposed to put it back. You're supposed to throw it away.
Right, your floss, not your toothpick.
They
discourage the use of toothpick.
So doctor is telling us today, I think I have to change that. Don't doctor, this one day.
You can get this one. It's not expensive.
Oh, okay.
25 pieces in the
So the hotels and the restaurants we've been going to eat, stop giving us toothpicks.
Right.
Put this one there so that when we finish
carry
eating,
your own. So that because the other thing is, if this is in the hotel,
we'll finish it. If
not
I go,
even the finishing. Somebody has finished eating, gone to put his hands here. He will touch some of this, pick just one. And then you also go and pick.
It will be contaminated, yeah.
So
it's
not expensive. So once
ladies can easily carry it. We have a lot of things in our bags.
Right.
Anyways, we're learning so much here. Let's go for our final break. We'll be back to wrap up.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of kingdom dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back to the Reflection Show. We are here to wrap up, and I believe that you've understood or you've learned something new on how we can keep our teeth clean, especially for parents, for children that you are nurturing, that you are grooming. We need to keep their teeth or they have to stay clean, because kids play a lot. Some will even go and eat sand, some will do other things, and all goes in there. So parents, we really have to be very watchful and make sure that our children are very healthy. So in wrapping up on this, your final words.
Okay, so what I would say is we have taught you how to brush. We encourage you to brush in the morning and in the evening.
Okay.
And as I always say, evening brushing is very
more important
A lot
than
of
the
people
morning.
don't brush in the evening. The reason why it's more important to brush in the evening is the length of time that you are going to be asleep. The mouth is inactive. Saliva flow decreases. So if you have food particles in the mouth, bacteria would act on that. The cavities we develop actually happens in the night because of the long period of time. So you brush in the night, remove all the particles, you go to bed the following morning. Even if you don't brush in the morning, it's far better than not brushing. But we advise that brush morning and evening.
Okay.
Again, we advise that every 6 months you visit your dentist, whether you have a problem or not. Just do a general check. You might find something unusual. The dentist might find something unusual. And in these days of other groups, apart from even your teeth having cavities or your gum having problems or discolorations, the dentist might see an abnormal or an unusual groove in the mouth. So once that groove is investigated, if it is a problem, it is nipped in the bud, because these days cancer has become so rampant, and as I said earlier, cancer can occur in any part of the body. So it is also good to have regular dental checks. Change your toothbrushes, do your regular brushing, eat well, drink more water, because water is a cleanser.
Okay.
Drink more water, eat more fruits, and would all be healthy. Just to add that this December, we will be running a promotion.
Yes, I was coming to that.
At Cornerstone Dental Clinic. We are giving everybody who comes for our normal dental prophylaxis, what we call scaling, or the layman call washing. We are giving 30% discount to all everybody who comes.
Hey, 30%.
So if you come in December, you would enjoy that package.
Wow.
Right.
Wow. Do you want to give any phone numbers?
You will not pay consultation. That's the other good thing.
Oh, you don't pay consultation. You still get 30%.
So the procedure cost, you will get 30% without paying consultation.
Wow. So all you have to do is just to get to Cornerstone Dental Clinic in Tamale, opposite Garaba Law. Do you want to give up your contact details?
So the number to call is 0244-791435 or 020-89-14017.
Okay, so call them and get all your dental needs sorted. Read more about halitosis, read more about brushing, read more about flossing, read more about everything we've discussed here. Make sure that you are staying strong and you are staying healthy. This season is a very interesting season because everybody wants to eat something, everybody wants to go out with friends and family, but make sure that you're not eating something that will be harmful to your teeth or harmful to your gum. And before you go to sleep, please don't carry this to the next year. Start brushing in the evening before you sleep, just 3 minutes and you are done. You get your teeth brushed and you can have a good night's sleep. You have some funny dreams because you've not brushed your teeth. My hair and makeup is by In-Depth Beauty Salon. We are still calling on partners and sponsors of the Reflection Show. Come and join us. Let's inspire a lot more people, especially young people out there. My name is Martha Anabila. Do have a good night. Hello and welcome to Thoughts from Martha Inspires. I am Martha Anabila. Today I want to talk to you about what I have captioned, do you want to grow? There are lots of times we say, I want to grow, I want to become bigger in this, I want to become bigger in that, but we don't plan ourselves for the price we have to pay. In your career, do you want to grow? Even in age, do you want to grow? In your Christian life, do you want to grow? In your business, do you want to grow? Are you ready for the price, for the disappointment, the issues that comes with growth? As you are growing, are you sure that you want to grow? Because growth is painful, growth is selfish, growth is annoying, growth is something that will make you feel uncomfortable. Every business person understands that if you want to grow, you have to make a lot of sacrifices. Are you ready for that kind of sacrifice? Are you sure that you want to grow? In whatever endeavor you are partaking in life, I want you to understand that there is a price that you have to pay for you to grow. Sometimes we are like, oh, I want to grow, I want to do this, I want to do that, but we have forgotten that there is a serious price that we have to pay for us to grow, and we end up thinking that, oh, because this didn't work and that didn't work, I am quitting. If you want to grow, you have to be ready for the price, be ready for the sacrifices, the disappointment, the pain, the anger that comes with growth. Growth is not easy. And as every young person watching me today, understand that there is this kind of pain, emotional pain, psychological pain that you will encounter at every level of your growth. So if you are growing in business, you are growing in health, you are growing in age, in any way that you are growing, understand that there will be challenges, there will be issues. People will leave you, they will become angry with you, and they will hurt you. But you know what? There is always light at the end of the tunnel. Whatever you are going through, whatever issues you are facing, is part of the growth that you are seeking for. It's part of the growth that you are hoping for. So be able to understand that you need to pay for the price. Pay for the price. And the price comes in different ways. The price comes differently from different people. Somebody can be paying a price differently, but you will not pay the same price. So if you want to compare your growth with other people's growth, then you would never be able to grow in the way you have to grow, because growth is different. Grow gracefully. Grow graciously. Grow according to your strength. Do not copy people's growth. Grow because it's something that is going to make you outstanding. It's something that's going to make you great and amazing and wonderful. Growth is good. Growth is wonderful. But do not copy how people grow, because your endeavors and your growth would never be the same as other people would grow. So if you want to grow, understand the process, understand the mandate, and grow in that endeavor. Don't say, oh, 2-3 years, nothing is coming on, I'm not seeing profit, I'm not seeing that. Growth is painful, growth is annoying, growth it's something that is not pleasant. Growth is not easy. I believe that if you have watched this episode, you've understood that you have to go through the process of growth and be the best version of yourself, and don't compare any other person. Thank you for watching today's episode on Thoughts from Martha Inspires. I am Martha Anabila. See you next time. Hello and welcome to Thoughts from Martha Inspires. I am Martha Anabila. Today I want to share with you on what I have captioned, purpose is selfish. There are lots of times we are encouraging young people to search for purpose and identify their purpose and all of that. It's good, it's amazing, it's beautiful. But sometimes when you are fulfilling purpose, you'd have to go out of your way, out of your will, out of your comfort zone to please the people that you have to comfort. Purpose is something that it's like you have to come out from your comfort zone. Come out from the place that you feel comfortable in, because it wouldn't help you. If you want to concentrate on what people are saying, then you won't fulfill purpose. Today I want to plead with you that whatever idea, vision that is in your mind, understand that it will come with challenges, it will come with pain, it will come with issues that you may never be able to solve. Because you are born for purpose. You are born to be able to understand and fulfill purpose. Please and please, when the going becomes tough, understand that it is just about people, and God will give you comfort at the right time. Thank you for watching today's episode on Thought from Martha Inspires. I am Martha Anabila. See you next time.